What is cancer? Cancer is a group of diseases characterized by the uncontrolled growth and spread of abnormal cells in the body. Normally, the body's cells grow, divide, and die in a regulated manner. However, in cancer, this orderly process is disrupted, leading to the formation of a mass or tumor. Not all tumors are cancerous. Benign tumors do not spread to other parts of the body and are usually not life-threatening. Malignant tumors, on the other hand, can invade nearby tissues and spread to other parts of the body through the bloodstream or lymphatic system, a process known as metastasis. Cancer can occur in virtually any tissue or organ in the body and may manifest in different ways depending on its location and type. There are over 100 different types of cancer, each with its own characteristics, behaviors, and treatments. The causes of cancer are multifactorial and can include genetic factors, environmental exposures, such as tobacco smoke, ultraviolet radiation, and certain chemicals, lifestyle choices, such as diet and physical activity, and infections. Cancer diagnosis and treatment often involve a combination of approaches, including surgery, chemotherapy, radiation therapy, immunotherapy, and targeted therapy, depending on the type and stage of cancer. Early detection and advances in medical research have improved the prognosis for many individuals with cancer. But the disease remains a significant health challenge worldwide. What is the percentage of the population that gets affected by cancer? The prevalence of cancer varies by geographic region, age, and other factors. According to global cancer statistics from the World Health Organization, WHO, cancer is a leading cause of death worldwide, accounting for nearly 10 million deaths in 2020. The overall lifetime risk of developing cancer is estimated to be around 1 in 3 for men and 1 in 4 for women. It's important to note that the risk of developing cancer can be influenced by various factors, including genetics, lifestyle choices, environmental exposures, and access to healthcare. The incidence of specific types of cancer also varies. Some common types of cancer include lung, breast, colorectal, prostate, and stomach cancers. Cancer rates can change over time due to factors such as aging populations, changes in lifestyle, and improvements in cancer detection and treatment. Regular screenings, lifestyle modifications, and early detection efforts contribute to improving outcomes for many types of cancer. What is the percentage of the cancer patients that do not survive? The survival rates for cancer vary widely depending on factors such as the type and stage of cancer, the age and overall health of the patient, and the effectiveness of the treatment received. It's essential to understand that survival rates are statistical estimates and may not predict individual outcomes. Survival rates are often presented as a percentage of people who are alive a certain number of years after diagnosis or treatment. These rates can be reported for specific cancer types and stages. For example, a 5-year survival rate indicates the percentage of people who survive for at least 5 years after diagnosis. It's important to note that survival rates have been improving over the years due to advancements in cancer detection, treatment modalities, and supportive care. Early detection, access to effective treatments, and lifestyle factors can also significantly impact survival outcomes. For accurate and up-to-date information on cancer survival rates, it is recommended to consult reputable sources such as cancer registries, health organizations, or medical professionals who can provide data specific to the type of cancer and its stage. A report from the American Cancer Society released shows continued decreases in cancer deaths. But health experts say more could be done regarding cancer prevention. The organization's annual cancer statistics projects over 1.95 million people will be diagnosed with cancer, and nearly 610,000 will die of cancer in 2023, an uptick from 2022 projections. Despite the slight increase, the ACS says the numbers represent a continued decline of cancer deaths. Mortality rates dropped by 1.5% from 2019 and 2020, and overall cancer mortality has decreased 33% since 1991, an estimated 3.8 million lives saved from cancer. Cancer accounted for 18% of the 3.3 million recorded deaths in 2020. The latest year data is available, and is the second leading cause of death after heart disease. The 5-year survival rate for all cancers combined has increased from 49% for diagnoses during the mid-1970s to 68% for diagnoses during 2012 through 2018. Survival is highest for thyroid cancer, 98%, prostate, 97%, testis, 95%, and melanoma, 94%. Survival is lowest for pancreas, 12%, and liver and esophagus, 21%. The American Cancer Society projects more men and women will die from lung and colorectal cancer, compared to any other cancer, in 2023. While lung cancer death rates dropped by 58% from 1990 to 2020 in men and by 36% from 2002 to 2020 in women. Researchers say it's still the leading cause of cancer, mostly due to smoking. Approximately 81% of the 127,010 estimated deaths from lung cancer in 2023 will be caused by cigarette smoking directly, the report estimates. An additional 3,560 lung cancer deaths will be caused by secondhand smoke. Colorectal. Meanwhile, researchers estimate 52,550 people will die from colorectal cancer in 2023. Prostate cancer is the second leading cause of cancer death for men in the United States. And the progress made since 2014 toward reducing rates has recently reversed, the report said. Researchers, meanwhile, have highlighted an astounding drop in cervical cancer in young women since 2012. The report found a 65% reduction in cervical cancer rates in women ages 20 to 24 from 2012 through 2019. Rates continue to decline about 2% annually in Black, Hispanic, and Asian American Pacific Islander women 50 and older. Health experts attribute the progress to routine screening and the HPV vaccine. The human papillomavirus, or HPV, is the most important risk factor for cervical cancer, according to ACS. What are the top 10 cancers reported? The most common types of cancer can vary based on factors such as geographic location, gender, and other demographic considerations. The following list provides an overview of some of the most commonly diagnosed cancers globally. 1. Lung cancer. Lung cancer is a leading cause of cancer-related deaths worldwide. Often associated with tobacco smoking but also occurring in non-smokers. 2. Breast cancer. Common among women, breast cancer can also affect men. Early detection through screening and advances in treatment have improved outcomes. 3. Colorectal, colon and rectal cancer. This type of cancer affects the colon or rectum, and is often linked to lifestyle factors, such as diet and physical activity. 4. Prostate cancer. Prostate cancer is common among men and usually develops slowly. Regular screenings and early detection can be crucial. 5. Stomach, gastric cancer. Stomach cancer can affect the lining of the stomach, and is influenced by factors like infection with Helicobacter pylori and dietary habits. 6. Liver cancer. Hepatocellular carcinoma is the most common type of liver cancer, and is often associated with chronic liver diseases, such as cirrhosis. 7. Thyroid cancer. Thyroid cancer affects the thyroid gland and is often treatable, especially when detected early. 8. Bladder cancer. Bladder cancer can occur in the lining of the bladder, and is more common in older adults. Smoking is a significant risk factor. 9. Non-Hodgkin lymphoma. This type of cancer affects the lymphatic system and includes various subtypes. It can arise in lymph nodes and other lymphoid tissues. 10. Kidney, renal cancer. Renal cell carcinoma is the most common type of kidney cancer, often diagnosed in adults. It's important to note that the prevalence of specific cancers can change over time, and regional variations exist. Additionally, ongoing research and advancements in medical science may impact the understanding and management of various types of cancer. For the latest and region-specific information, it is advisable to consult reputable health organizations and cancer registries.